Is there any change that you're seeing that we wanted to know about, or is it going to be what we are doing right now?
You mean in general or with Women for Women?
In general and with Women for Women both.
Yeah, in general, the biggest thing that's coming down is in 2027, they are going to stop bundling all the OB service, which is what I described originally, that you didn't bill until the end of the pregnancy after delivery. Now we're going to be able to, that's what we're told, we're going to be able to bill as we go along for the ultrasounds and the visits, etc., which is going to be helpful because people move very often in the middle of pregnancy, and so it makes it difficult to get paid for what you've done so far, or when someone comes in at the end to your practice, it's been difficult. So that's probably the biggest change that I see, business wise, for women for the practice in general. Women for Women, like I mentioned, we're undergoing a big period of growth. We have two physicians probably joining within the next year, and then at least one or two more within the next few years.
That's nice. And I can
Yeah,
relate to that problem because we moved when my wife was pregnant. We
really.
moved city to city, and it
Hmm.
was very hard to find a provider when you are like 6 months into your pregnancy. Nobody would
Right.
like to take them. And we literally have to work with our insurance to get to a provider, not even our
Wow.
choice.
Yeah, that's hard.
Right. So you're saying that that part is moving away so that you can bill each individual visit as its own visit.
Yeah, that's what they're telling me. I have my billing person doing an economic analysis of that, like whether we'll
Mhm.
actually get paid more. Um, of course, the hope is that we'll be paid more, but
Right.
we'll see. We'll see.
Right. And how does this work, Dr. Reed? That if you have to research on the on what's going to happen, is it the general research, or you go to the government websites and get more information from there, or is it the insurance driven or a government driven mandate that's coming through?
Since most of our patients are privately insured, and we have a very large segment that are Blue Cross Blue Shield, we would
Mhm.
start there with the research.
Okay.
And then, yeah, we do have, especially for the midwives, they have a Medicaid population, and so we would go to the government ones for that.
Right. But the mandate that you're talking about, is it
Hmm.
like insurance providers driven or the government driven?
I think it's insurance provider driven, but I'm not sure about that. It's a good
Right.
question.
Right. Okay. Okay. And anything else that you wanted to talk about? What Women's for Women is going to do?
Mhm. Well, yeah, we just added a third person in our aesthetics group, and she's in
Uh-huh.
RN. So we're going to be able to offer more medical procedures. For instance, if a patient has a problem with like nausea and vomiting from pregnancy, she'll be able to do IVs for those patients and give them IV fluids. She's going to manage our weight loss clinic for us as well. So I see big growth with her coming on board.
Thank you.